Hi, I think people are joining now. So welcome everybody to the second of the Evidence-Based Social Work Alliance webinars, which today is on working with children and issues of gender identity. So we as the EBSWA is social workers who are in practice and in teaching and in research, and who share a common concern about the lack of evidence for what we are being told about gender identity and about how to practice. And we're concerned for children who are being told that they are transgender. And we also are concerned about the silencing of discussion and intimidation of social workers and others who challenge it. So I'm a social worker, and I want to just explain a bit about, but I work independently and I'm also past retirement age. And so I can speak out without fear, but a number of our members are not in that position and are threatened with the loss of their jobs for being identified as having gender critical views. Social Work England and other regulators seem to have been captured by gender identity ideology. Some of our members have been investigated for transphobia for merely insisting on the reality of sex and raising concerns about children and vulnerable adults. And Social Work England actually requires social workers to register with a gender identity and not a sex. They don't allow you to have a sex, just a gender identity. So we're taking that one up. And that's why we formed Evidence-Based Social Work Alliance, EBSWA. And Time for Evidence is our challenge to the regulators, to the employers, to CAFCAS, the Children's Court Social Workers in England, and to BASWA, our professional association. So this afternoon's webinar is on working with children and issues of gender identity. We're absolutely delighted to have two really excellent speakers, and who couldn't be better speakers for this topic. And we're also really pleased to welcome you, and by the response we asked for you to send in your questions, and the range and quality of questions was really excellent, and they've been shared with Sinead and Stella, and we're going to work through as many of them as we can in the session. Now, just to introduce the speakers, Stella O'Malley is a psychotherapist and founder and author, and she's the founder of Genspect, which I think most of us will know, but if you don't, it's really worth checking them out. And Stella also co-hosts a very useful podcast, which I listen to many nights. It's called Gender, A Wider Lens, which I can really commend to you. And then Sinead Watson is an advisor to Genspect, and she works with the Gender Dysphoria Alliance and with Detrans Voices. Sinead's one of a number of young women who have detransitioned and are speaking out about the scandal of the permanent harm which has been done to them by professionals acting on the demand affirmation without question. So the format for our session is I'm going to invite them both at the beginning to just introduce themselves and tell us about their journey to the place of concern that I think we're all in now, and the action that they're taking and where they've arrived at today and the work that they're doing today. And then we'll move on into the questions that you've sent, and hopefully we'll have a really busy and really informative hour, because people are desperate for information and knowledge and to be able to talk about this safely. So first of all, I'm going to go over to Stella and ask her to tell us about her journey to this point and about her work. Stella.
Hi there, and it's great to be here. You know, I'm a psychotherapist, and I'm so pleased to see social workers joining this kind of issue. I was delighted when I first came across EBSWA. I was like, just what we need. Because so often, you know, there's psychotherapists who are very involved, but I wasn't finding that in the wider field of mental health that there was too many people involved. And it's just such a necessary kind of important aspect of gender, that people become very well informed. So my own story is long, so settle back. It goes back, I'm an old woman, and it goes back to when I was a kid. And when I was a kid, I had a very, very extreme experience, and I really think, I know a lot about gender dysphoria now, and I know a lot about the diagnosis, and I would have easily been diagnosed with gender dysphoria as we know it now. Back then it was called gender identity disorder. And back then it was ignored because that was the kind of world we lived in. And so I had that very extreme feeling of not wanting to be a girl, not relating on any level to being a girl, disliking girls, hanging out with the boys, and kind of, I look back on it, and now I have the words, I would call it an extreme level of internalized misogyny. I didn't like girls, didn't like girlish things, thought they were annoying, and I was completely alienated from them. And I knew exactly where I should be, and that was with the boys. And I was very comfortable with the boys, and I kind of knew I'd be better as a boy. And honestly, I think there is something in that. I think I would have been great as a boy. And but I wasn't born that way. And so off I went in my way. I had a difficult childhood for many other reasons. And so I was quiet about that, but I certainly wasn't quiet about the fact that I wanted to be a boy. And I remember Ken Zucker, the psychologist, talking about how when a kid has gender dysphoria, the town knows it. When a teenager has ROGD, it can often be quite a silent experience. But when it's a kid, everybody knows it because they haven't learned to kind of filter. They just say, I'm a boy. So everywhere I went when I was a kid was, are you a boy or a girl? And I'd say things like boy or no. So I was kind of non-binary before it even began. But then it rolled on, and I remember puberty was really very, very difficult for me, and I didn't know how to get out of it. I realized that nature was bigger than me. I realized that puberty was just out of my control. There was nothing I could do about it. I was very, very unhappy in my body, very ill at ease, disconnected, and I didn't know how to get the hell out of it. I didn't know what to do. Everybody knew me as a boy. I was the only kid in the school. There was girls and boys in my school, and I was the only kid who wore trousers. The boys wore trousers, the girls wore skirts, and I was the only girl who wore trousers. So I'd really positioned myself quite extremely, and I didn't know how to get out. And I realized I'm a girl. I came to a reckoning. I realized everybody knows it. They were indulging me, and they were playing along. And now where the hell am I? And I had I look back, I have a good memory of being a kid. And I look back and I was in such a difficult position. I didn't know what to do, and I didn't know how to get out of it. And I wasn't friends with my body. I wasn't accepting of my body, but I realized my body I was stuck with it, and there was nothing I could do. So then life went on. I got through puberty, and ultimately I became comfortable in my own skin. It took me many, many years. But I was certainly, I gave up on the idea of as such trying to be a boy. It wasn't an option. Now Sinead would be coming after me, and it was an option. So all sorts of things open up when you've got an option. I didn't have that option. It wasn't a feasible option. Born in 1974, it just wasn't a feasible option. Certainly wasn't in my landscape. And so off I went into my life. And then many years later, I became a psychotherapist when I was about 30. And many years after that, I realized that the gender identity debate was kind of becoming a little bit strange and certainly very intense. I do remember when LGB, kind of the gay, lesbian, bisexual group, turned into T in the 1990s. And I remember having a lot to say about it, thinking, why is that joining with sexual orientation? That's very different. And I remember I'd get blank looks from people, like, what are you talking about, Stella? And I was like, well, it's blindingly obvious something different. And I had that affinity to the feeling of gender kind of incongruence. I was totally bothered about that at the time, and nobody really knew what I was talking about. And I just thought, that doesn't make sense. That's a weird grouping. It just doesn't make sense, because these are two different things that are happening. One is about sexual awakening and sexual feelings, and the other is about a feeling of disconnect with your body, which is very uncomfortable. These are two very different experiences. And one doesn't need medication, and the other, obviously, generally, medication is sought after as the kind of resolution to the issue. So I became a psychotherapist, and I noticed that gender issues was an issue. And I often write, I've written a few books on parenting and mental health, and I often write for the Irish media. And I thought to myself, I really must add my voice, because I don't see my narrative in all this talk. This is about 2017, all this talk about gender, I wasn't seeing what I had, my experience. And I'd said it to my husband a few times, even in 2016, must write about this. I don't see where my story is in all this talk, because it was just becoming more and more prominent in the media. I'd imagine around about that time, Sinead, and I'm dying to know, you would have been getting your head turned by the whole thing. So we were all getting our head turned by gender around about then. And so I was interested. And so I decided to write an article for the Sunday Independent in Ireland about it. And I basically said, I had a very, very intense experience. It lasted for many, many years, around about the age of 3 to in and around the age of 10. And then there was a very slow pulling off of the plaster that lasted some more years. And so where are all those kids and what's the story with them? As a result of that article, I was asked to do a TV show, a documentary for Channel 4 called Trans Kids, It's Time to Talk. And the premise of the film was why, basically, where are children like Stella in the 4,000% explosion of adolescent girls seeking to medically transition? Where is Stella's story? Because it does seem to be that it's not that unusual. I didn't know my research then, but I now know 80% of kids are like me. 80% of kids have these very intense, diagnosable, clinical, seeing a psychiatrist level of gender dysphoria, and they grow out of it. And so I wasn't uncommon. I was the more typical scenario, but that wasn't being seen in the 4,000% explosion of girls who wished to transition. There was a presumption because a new way of being came in with the standards of care with WPATH in around about 2012, where basically everybody was affirmed. And that means they were told, if you want to be a boy, you're basically immediately shown how to be a boy, as opposed to explored. Maybe there might be other things motivating you. There might be easier paths to go down. Maybe there can be kind of internalized misogyny. There can be internalized homophobia. There can be a lot of things going on. And any good therapist knows that. So affirmative on a lot of levels is quite anti-therapeutic. Therapeutic means exploration, compassionate curiosity, kind of in-depth kind of perspective. Affirmative is quite a surface, narrow-minded, kind of like your slightly annoying friend who just says, yeah, 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 to everything you say, and doesn't really give you much time to explore it and to delve in deeper and to kind of think, where am I with this? It's somebody who kind of rushes you along with a kind of, you've said you wanted to do it, so let's do it. And so I'm quite uncomfortable with that model, but that's what was recommended since 2012. And so we did the film and we got a huge amount of pushback. I remember at the time, the Tavistock were very, very much in disarray. An awful lot of organizations wouldn't speak to us. They shut us down. They actively tried to sabotage the film. And the director, who's a very well-known director, who's had loads of awards, Ollie Lambert is his name. He's done films in Iraq and in Israel. And after our film, Trans Kids, he went on to do a film with Israel and Palestine. And he found it easier to talk with the Israeli leaders and the Palestine leaders than he did with the trans lobby, because he couldn't talk to both sides with the trans people, while he could talk to both sides with Israel and Palestine, which is a measure of just how difficult this debate is, that there was no room to kind of explore and just consider, could we perhaps be rushing children along? Could there perhaps be other methods? There was just no room for that. Everything that was a question was deemed transphobic. It was a very chilling year. That was 2018. It came out at the end of 2018. And it was a shocking, shocking experience. And from then on, I became very involved in this world. And so many people contacted me after the film. Some people they'd already transitioned. I often call them lost in transition because they are unhappy. They find it difficult. The heavy burden on the body is really starting to impact them. They feel ill at ease, and they often feel that they didn't receive good therapy. That was one kind of cohort of people who were emailing me. And as a result, I became involved in the IATTT. That's the International Association for Therapists for Detransitioners and Desisters. It's iatdd.com. And we set that up to cater for people who had transitioned and weren't happy in it. Like I say, lost in transition and really had quite serious questions to ask of where they wanted to go from this point on. Some detransition, some don't. Some navigate like their life with transition because that's where they've gone and they don't want to go back. And then I have been inundated since then with parents parents saying, my child has many, many diagnoses, has autism, has ADHD, has depression and anxiety, and has suddenly been diagnosed with gender dysphoria, or much more often self-diagnosed with gender dysphoria. And as a result, they're determined to transition. But it doesn't make sense because all the other diagnoses are getting dismissed. So if they have 4 diagnoses, why is one trumping all the others? Why is one getting all the attention and not the others? And so parents were asking very valid questions, and I was stunned by how many parents were so distressed. And I went to the first ever detransitioners conference. It was in Manchester before the lockdown, about November before the lockdown, 2019 that would be. And I met some parents who asked me, is there any chance you could do some therapeutic care for these parents, because nobody's listening to us and there's many of us. And so when lockdown happened, I had a bit of time. I said yes to them, I'd love to, but I have very little time. But when lockdown happened, I did have time. And so that would be about March 2020. And I started the GDSN, that's the Gender Dysphoria Support Network. And that's basically therapeutic meetings for parents and families and siblings who've been impacted by gender dysphoria in the family. Sinead very kindly came and spoke at one, and it made a huge difference. It was amazing. So what we did is we just started with one meeting a week where we just meet parents who are all saying the same thing. My quirky, socially awkward, intense kid, my cerebral kid, my kid with loads of diagnoses has suddenly latched onto gender and is kind of negating and dismissing every other issue in their life, and it's fixated on one thing and one thing only, and they think that it's going to be the solution to all their problems. And everything I know about my gorgeous kids suggests it won't be the solution, because they're complex and they've many, many problems. And they need more than one solution. They'll probably need many. And it wasn't fair. The parents felt that these kids were given effectively the false allure of, you can be a different person. You can be a different person with a different name, a different identity. Nobody will be able to refer to your old personality or your own identity. You can be somebody new and it's going to be magical. That's a very, very, very inviting thing to say to a disaffected, distressed, like alienated 14-year-old who hates their body. And so I started those GDSN meetings, couldn't believe it. Within a week, we went to 2 meetings a week, then 3 meetings a week, 4 or 5 meetings a week. We expanded very, very fast. And I realized, oh my God, there's something massive happening here. As a result, I'm coming to the end finally. I'll never get to talk again. As a result, we started Genspect, and Genspect is an international alliance of all the parents groups in the world. There's thousands of us, and we're all saying the same thing. All these parents are saying the same thing. My child is being fast-tracked. Other issues are being ignored, and we don't believe that they're getting good quality therapeutic care. And as a result, Genspect has gone strength to strength, really. And we're very happy that Sinead is an advisor, because she's a brilliant representative of a thoughtful, nuanced understanding of what's going on when gender issues afflict you. And they really do hurt very badly when they do. So there we are. You're muted. And just before I finish, we do have guidances for mental health practitioners in Genspect. So if you go on to Genspect and you look at the guidances, you'll see that we have guidances for mental health practitioners who are, seeking help.
Great. Thanks very much, Stella. There actually are a couple of mental health practitioners registered, so hopefully they'll hear that. So yeah, I'm now going to move on to Sinead, who I first met when she came along and spoke, just as Stella said brilliantly, at a meeting that Joan McAlpine had hosted in the Scottish Parliament that I organised, which had David Bell and Sinead and Glasgow GP Margaret McCartney speak, and it was. So I think expect Sinead to be just as informative and good today. So do you want to kick off in yourself, Sinead, and tell us about your journey?
Yeah, I mean, it's strange because my early experience was so similar, but also so different from Stella's in many ways. And that, like, I was the little tomboy, I hated dresses and I hated pink and all the rest of it. But the difference for me was that was very much the norm when I was a little girl. All my female friends were also tomboys because we were dirt poor and we couldn't afford fancy toys or sparkly dresses. So we would just go out and build dens and throw rocks at things. Dresses were not the best attire for that. So I never felt any kind of gender dysphoria as a child, in that I didn't feel ostracized or different from the other girls. And I told that to my gender clinic, when I went there. I was tomboy, but other than that, a very normal, happy little girl. Um, so when a lot of people who want to talk about trans issues and things like that, and they find me, and I'm like, I wasn't a trans kid. I can't speak on that. What I can speak of with a little bit more experience is the development of what I will call my gender dysphoria, because that's what it was diagnosed with. I've since evolved a little bit in my thinking about if what I have is gender dysphoria. I'll touch on that in a little bit. Um, but when I was a teenager, specifically when I began to develop, is when I started to experience that I was being treated differently. So when I was a little girl, I wasn't treated any differently for the boys or the girls. And then I became a teenager who was developing into a young woman, and I was being treated differently. There was now expectations for things that I could say or things that I could like, or the way that I could even sit or walk and things like that. And very similar to Stella, I think, and I really don't like using this term because it sounds so PC, but it's also accurate, is I really do think that I developed internalized misogyny. Like I hated girly things, and when I saw other girls my age who liked talking about boys and shopping and makeup and all that, like in my head, I was like, you're beneath me. Like, and I'm being honest and I'm ashamed to admit it, but I really did think that way. It's like these girls are beneath me because I'm not like them. I'm not like the other girls. you know? And then the more sort of serious and I suppose more depressing aspect of it was I started getting a lot of very unwanted sexual attention as well, because from about the age of 14, I had a very large chest, I had a small waist, and I had wide hips. And so even though in my mind I was a little girl, my body was very quickly becoming that of a young woman, and I just was not prepared for the reaction I got at all. Um, so by the time I hit, I don't know, maybe 16, 17, I was in my first job, and my manager was incredibly inappropriate with me for all the years that I was there. He was in his 50s when I was 16, and there was lots of other stuff happening at the same time. So by the time I hit my late teens, my experience was I hate being a woman. I hate having this body. I feel far more comfortable with the boys. I want to be, funny and wear men's clothes and all this stuff. I don't want to be constantly sexualized and treated this way just because I'm a woman when I don't want to be treated that way. Um, but again, I wouldn't say that was gender dysphoria. I think that was a very natural, unfortunately, probably a very common response to a lot of negative experiences. Lots of young women feel that way. They don't think they're supposed to be men. So the big turning point for me was finding trans sites and forums and blogs and videos. So over the course of my 20s, I was like, okay, I hate being a woman. And then I thought, I really think I should have been born a man. My whole life, I just would have suited it better. I should have been born a man. And so I started Googling, because by that point, I've hit my 20s. It's now positively disrupting my life. I was very unhappy with being a woman. So I started Googling, I want to be a man. And I found trans material. And I found blogs and videos by young trans men who describe situations very similarly to mine, with the caveat being that they often finish their stories by saying something like, when I transitioned, all my problems went away. When I started testosterone, my depression disappeared. When I got my top surgery, otherwise rightfully known as the double mastectomy, I felt more complete as a person. And so I was reading all these stories and I was relating to them. And I just thought, this is me. This is absolutely me. And over a very, very quick span of time, actually, probably less than a year, I went from being a woman who hated being a woman to being a trans man who should have been born a man and was born wrong and now had to transition. So that was quite quick. And so I self referred myself to my gender clinic, and they put me on a waiting list. I was on a waiting list for a year. I didn't receive any therapy or counselling during that time. I won't try to make myself sound too crazy or anything like that, but while all this is happening, I'm having like severe breakdowns. I'm being put on psychiatric backwards. I was very, very all over the place in my 20s. But eventually the clinic gets back to me and they say, okay, come in for your first evaluation appointment for gender transition. So I go to the clinic, and when you arrive, before the evaluation even begins, you just sit down and have a chat with your gender specialist. And before the evaluation began, he was calling me Mr. Sean Watson. I was a man, I was a he, him. You know, it was complete affirmation from the get-go. There was no challenge and there was no question. Even before the evaluation had begun, he was referring to me as if I was a trans man. And that was the last piece of evidence that I needed. I'd already convinced myself so much that I was a trans man, and I was afraid to go to the gender clinic because I knew I was atypical, because I didn't have gender dysphoria as a child. And I thought, I'm going to go to this clinic, he's going to challenge me and he's going to question me, and it's going to be very uncomfortable. It was so easy. There was none of that. And so when I walked out of that first appointment, my honest opinion was, well, if the gender professionals are recognizing I'm a trans man, then clearly I am. And there's no need to doubt and there's no need to question. What affirmation did to me was embolden me to rush my transition as quickly as possible. And I'll touch on that when we talk about affirmation later. But yeah, I took testosterone for 4.5 years. You can see and hear the impact it's had on me. I got the double vasectomy. And then I eventually realized that all these problems that I had in my mind weren't magically gone just because I changed my body. And it sounds obvious when you say it like that, but it really came as a massive surprise to me that transition hadn't helped me. In fact, it made me worse. So I began my detransition process in 2019. And I've spent the past 2 years talking to so many different people. I've been talking to trans people and detrans people and parents and GPs and therapists and just, teachers and things like that. And I think they message me because they're like, oh, you're a detransitioner speaking about this. I know that if I tell you all my concerns, you won't go away and report it and make me lose my job. And then I met Stella and Genspect and all these other people. And I've been involved in a lot of other different groups, including things like Detrans Voices, which is run by and for detransitioners. And it's kind of weird. I'm now sitting here in 2021, and I've spent the past 2 years looking into this and studying it and speaking to so many different people. And the best way I can really put it is I'm really, really afraid and I'm really, really angry, which is why I'm talking about it. So happy to have the discussion about it now.
Great. Thanks very much, Sinead. I think both of you, I feel a lot of resonance as well. And
I
I'm
think
sure
you're still muted now.
Oh, no, I'm sure should be unmuted. Am I unmuted?
Yeah, I can hear you.
Ah, great. I'm unmuted. Yeah. So yeah, I feel a lot of resonance with that. And I'm sure a lot of other women listening maybe do similar experiences, not as extreme in adolescence, but certainly can relate to if anybody'd said I could be a boy if I took a pill, I'd have been taking that pill and more at the age of 11. I used to spend nights imagining how not to have breasts and maybe thinking about crepe bandages and things like that that might stop it happening, just like breast blockers. But like Stella, it wasn't an option to transition. So thank God I didn't. So there we are. So the next, we've grouped the questions and contributions into sort of some broad areas just to help us structure them. And the first ones were about evidence. And really the very first question was, what evidence exists? This is maybe one for Stella as a therapist. What evidence exists that children are born with an innate gender identity that could be different to their sex? What's
I lost you very briefly there.
Is Sinead back in? Yeah, you got
back up? You can hear me again. I'm just asking the question about evidence, so Stella's going to answer that.
There is very little evidence. There is no evidence. There is a lot of conjecture and there's a lot of guesswork, but there is no evidence. There's the thing about gender identity, it's unfalsifiable. It's like your soul. One person can say you have it and somebody else can say they don't. And who are we to argue with either of them? One person, maybe they do have a soul and maybe the other person don't. I don't know, because I can't kind of open up your body and find it. It's nowhere in, it's not like your appendix. It's something, it's a sense inside you. It's a feeling inside you. And so when what one person might describe as their gender identity, somebody else could describe as their sense of self. And what is your sense of self? It's getting really into very esoteric kind of world. As far as evidence goes, some people have noticed that, let's say, people talk a lot about brain imaging and brain mapping and things like that. However, you know, there is an impact of hormones on our body. And so no matter what your brain is like, imagine if you're quite gender non-conforming. So your brain could be a slightly kind of more masculinized brain. Certainly I have a more masculinized type personality. Does that mean I have a masculine gender identity? Or does that mean that is my personality? It's a really, really difficult, really complicated thing. And certainly brain science is nowhere near it. They haven't figured it out. They don't have anywhere. Nobody has found and said, there's your gender identity, got it. There in that little space in your mind. No. It's like I say, it's a feeling inside you. Very like your personality, or else very like your soul. And that is not something that science can pin on. All we can do is either believe people or not. And that's when you get into really strange territory, where if somebody says it, do we immediately just medicalize it, or do we explore it? And is it hurtful to explore it?
Right. There's another question here along those lines, which is quite interesting, I think, which is how do we keep an open mind and consider, no, sorry, hang on. I'm growing as a teacher and going increasingly concerned with the way adults are affirming children without question. I want to see more evidence. But she asked, or he, I think it's a she, are we suddenly incapable of successfully fertilizing and gestating an XX or XY fetus? So I think maybe behind that question, and I've heard this raised, is people saying, is there something going on that's different in children today than children from the 1970s or the 1950s like me? Is there something happening? Is there something in the water?
I'll tell you, a few things are going on. Certainly children are hypersexualized at a younger age. Certainly an awful lot more porn is going on for teenagers, that it's just so easily accessible, and it's notable and it's much more impactful. So those two things are going on. As well as that, in and around the early 90s, they started gendering all the clothes. And they started gendering the birthday cakes and the wallpaper and the cots and the prams and everything to do. And before that, if you look at Lego from 1980 versus Lego now, it's unrecognizably different. Pink Lego and blue Lego and all sorts of. So we've really gendered the children when we didn't need to. We could have just let them be free to be, not even non-conforming, just to be. This idea that girls can't play with trucks and boys shouldn't wear the fairy dress, it's very regressive. And I feel that if you want to know what's going on, society is going on. And frankly, why did they genderize the clothes? Why did they genderize the toys? To make money. But an unforeseen, inadvertent response has been kids who didn't feel they fell into the pink blue box. Those kids have been left going, where am I? Is there something wrong with me? And they are now being led into this concept of, well, maybe you should transition. If you're not A, you should be B. And that's not actually true.
Yeah. So nothing wrong with the children, just something wrong with how we're, what the world we're presenting them with. So we'll maybe move on to practice issues now. And the very first one, is, I don't know if it's practice or principle, but this is often presented certainly as a children's rights issue, and even a child protection issue at times, to demanding affirmation as a child protection measure. And that makes it hard for parents to have their responsibilities and rights heard. So how do we get that balance better? Or how do we, what is the balance between parents and children's rights on affirmation and treatment? How should we approach that?
And should I answer that, or should Sinead come in?
Can you guys hear me again?
Yay, we can.
Yeah, I lost you very briefly. I was just making sure I hadn't gone.
All right, no, we can hear you. Do you want to take it first, Stella? I don't know if Sinead heard the question, but
Balancing the children's rights and parents' rights, I think, is a huge issue. I'll take it and then see what Sinead says, but I'm really glad you're back in, Sinead. It's a huge issue. I think the undermining of parental authority has risen and risen and risen in a very insidious and subtle way. And I think the arrival of the parenting expert, and, I'm very uncomfortable whenever anybody describes me of that. I've written about mental health and I've written about parenting in a way that I hope would empower parents, as opposed to act as if they're these kind of inept fools that need guidance. Because I think most people would agree that most parents love their kids and care about their kids more than anybody else. And frankly, the passing professional who is in those children's lives isn't as invested in the long-term health as the parent is. And that undermining is a really unfortunate direction of the nanny state, that they presume passing professionals should gather and have authority over parents who are really genuinely very much caring about the long-term future. As well as that, we've kind of had in the undermining of parental authority, we've had a rise in children's rights, and that's brilliant. It's great that children have their voice and they have a stronger voice. But I think when it went from being child-centered to being child-led, you kind of are placing a burden of responsibility on young children's shoulders. And I don't think it's fair. For example, I wouldn't ask my children, what school do you want to go to? I wouldn't put that burden on their shoulder. I'll make the decision on the schools, and if it goes wrong, they can blame me. I wouldn't put it on their shoulders, because honestly, they're young and they'll have, frankly, immature ideas about what school they should go to. I'd let them probably choose their summer camp, but I wouldn't let them choose a hell of a lot else. I'd let them choose their own mates, but it's my job as the parent to put in the framework of their life, the mature decisions, the long-term decisions, whether we're going to move house, that type of thing is the adults. You don't inflict that on a kid. And so when they say children's rights, I'm saying, yeah, and what about children's burdens and children's heavy responsibilities that they don't need and they shouldn't be asked? Because that's how I think it's being missed. They're calling it rights, and I'm seeing it as a burden of responsibility that an immature mind shouldn't have to deal with. They should be free to do what they want, to act as non-conforming as they want, without people analysing and judging and inflicting concepts on them that they mightn't have thought about.
Yeah, definitely. That's very, 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 really powerful. Sinead, there's a question has come in saying, did your parents have any say in the decisions that were made about you? I don't know if you want to talk specifically about that situation, but maybe if you could say something about parents and children and families.
I'll sort of add on to what Stella was just saying and then answer that question. I mean, maybe Stella's going to come off as a lot more compassionate than I am here, but there's lots of things we don't let kids do. Kids don't have a lot of rights for a reason. We don't let them smoke. We don't let them drink. We don't let them operate heavy machinery. We don't let them have sex, There's a reason why we don't let them do that, and it's because they have not developed to the level where we understand that they understand the consequences. And so when it comes to things like your little boy or your little girl coming up and telling you, I'm the opposite sex, if it ended with, you can wear a dress if you want, sweetheart, you can cut your hair if you want, that would be fine. But what we're talking about when it comes to affirming children is eventually getting to a medical path, which children cannot consent to. They're too young. How can you possibly expect a little girl to understand the implications of being infertile when the actual idea of motherhood hasn't even reached her yet because she's a child? So, I mean, it's things like that where, children's autonomy and children's rights. No, children don't have that yet because they're too young and they haven't finished developing. And when it comes to sort of parents' rights, obviously there are abusive parents out there. We're not talking about them. We're talking about everyday normal parents. They know their child better than any psychologist or professional ever could, because they birthed them, because they raised them, because they're their child. And so if you were, as a parent, to take your child to a gender specialist and say, I don't think my child's trans, I think something else is going on. If we're now in a situation where that therapist can say, no, your child's trans and you have to go along with it, that's massively abusive and it's horrendous, and it's probably every parent's worst nightmare, because parents know their kids better than anyone else ever could. for my own parents, when it came to my own transition, because I wasn't a child at the time, I was in my 20s, they didn't have any say, in the sense that, you know, I was too much of a coward to do it myself. I asked my sister to do it, to call my parents up and tell them that I was transitioning. And my mum was very reluctantly supportive because she didn't want me to just walk away from her. And my dad was having none of it. He was like, "You're not a man, shut up, you're a woman." And I was like, "Oh, come along eventually, it's fine." So the sort of more traumatic experience that I think a lot of trans kids have with parents, depending on how they behave, isn't something I can relate to fully. But I think this one shared thing is the fear that parents have, regardless of their child's age, that if they don't just blindly affirm, they'll lose their kid in some way. That the kid will cut them off, the kid will stop talking to them, the kid will hide more from them. So this situation is kind of a lose-lose for parents. And I really, really feel sorry for them. But until clinicians and doctors have more courage to take the side of the parents, I don't really know where that could go potentially.
Yeah, yeah, yeah. I think another question that's come in is what do parents report about their experiences of the help and treatment offered by the gender identity clinic services? That's maybe one. I know, Stella, you work a lot with parents. So what are parents telling you about their experience when they enter this system?
It's actually very chilling what the parents are telling me. When they first told me, I used to kind of feel like I'd have to kind of almost decombust after the meetings because there were so many frightening stories. I'm talking about, parents who say, okay, you've got a gender issues, that's fine. I'll bring you to the gender specialist and we'll work it out. Don't worry, we'll bring the professionals, we'll give you all the help. And if you need to transition, we'll support you. Absolutely. And they bring them to the gender specialist, and within 45 minutes, they've been called, like Sinead's experience, immediately been called he, him, or the opposite pronoun, and immediately talk of medical transition. And the parent going, well, hang on, my child hasn't even so sexually awoken. So if they take puberty blockers, they don't even know what an orgasm is. They've no concept of infertility. So they're waving away their ability to be able to orgasm or their ability to have children, and they don't know what they're waving away. So the parents were like, this doesn't seem appropriate at all. Well, surely this isn't how it's done. And they'd arrive into our meetings literally in shock, going, you'll never guess what happened to us. And then they'd meet all these parents saying, yeah, that happened to us too. And you could see this kind of, that couldn't be. We thought we had one rogue specialist. And actually, you're all from kind of Idaho to Ireland. You're all saying the same thing. Yeah, that's fine. Yeah, that's fine. Work away, go on medication if that's what your child is seeking, and your child is 11 and doesn't understand the concept of having children, hasn't really appreciated any level of orgasms or a future sex life, because they shouldn't, because they're 11, and they should be allowed to just kind of, allowed to kind of live in a way that their kind of heavy interests don't dictate the next 60 years of their life. So I think it's really frightening how many parents have had very, very similar responses, just like Sinead had. And I know you were older, Sinead, but so are other kind of detransitioners were older. I know one guy, he's called Patrick, and he's from Germany. And he went to a psychologist when he was an adult, saying he thought that the psychologist would see something within him that would basically brand him as trans or not. And so he went to the psychologist, and within 45 minutes, the psychologist said, yeah, you're trans. Here's your prescription, off you go. And so Patrick, and he was on YouTube, he was amazing about it. He went off saying, okay, well, fine. Obviously, psychologist is the expert here. He's seen something that I haven't seen. Well, that I suspected, but, it's been branded. It's been officiated now. Off he went and he transitioned. Many months later, he was at a conference and he heard his psychologist talking. And the psychologist said blithely, oh, I affirm everybody who walks into my office. And Patrick had this moment of, oh my God, I thought you had seen something. You just affirm everybody. And Patrick went on to detransition. That's not right when you're talking about children, teenagers, and vulnerable people. That's not the way to treat them.
It's absolutely shocking, isn't it? That because Patrick's story was very similar to mine in that way, in that when I left that clinic, as I mentioned earlier, that was another piece of my evidence that I was trans, whereas I really do believe this. If I went to my gender clinic and they had said, okay, we need to talk about some of the other issues that you have. We need to address your depression. We need to address the intrusive thoughts. We need to address the alcohol addiction. We need to address the trauma and the assaults and things like that. I really, really do think that if I'd been given exploratory therapy rather than affirmation, that I would not have transitioned. Because my reason for transition was to get rid of problems. And if those problems had been addressed prior to medical transition, I would have felt no need to do it, you know? So I think when it comes to affirmation, people say, oh, it's kind and it's, you know, it's being polite, it's being courteous. It really isn't. It can be hugely harmful, especially when you know that most kids, when they don't socially transition or get affirmed, most desist. What are we doing, you know? It's
Yeah.
getting to that point where I'm feeling ranty.
Yeah. Wait, you're on mute, Maggie.
Maggie, you're muted.
It says I'm right. Okay, can you hear me? Sorry.
Yeah.
Okay, so there's a couple of other questions on those lines, and one is about parents threatened with the removal of their child. I think we know what the answer to this is going to be, but some parents have had the experience of being told that if they don't affirm their child's gender as what the child says, that the child might be removed. So I suppose that this question was just about what researched evidence is being used by those social workers to insist on this. And
can I just say that there's precedent for this? You know, we've had other kind of what would you call them, kind of contagions happen among our field, which is psychotherapy, social work, psychology. If you look at the multiple personality disorder in the 1990s, it was like at one point 1 in 20 people were being diagnosed. It was unbelievable in certain areas. It was unbelievable how common it was. Now nobody's getting diagnosed. Why? Because it's not fashionable. So we haven't covered ourselves in glory as a profession. We get caught up with diagnosis, and we get caught up with the feeling of feeling like God, this kind of absolute hubristic arrogance that a lot of people who work in my field, and myself included, and I try to be very wary of it. We always have to remain in the kind of standpoint of we're not the expert. We have guidance and we have training, but you know, a person is a very complex person, and to go fast and to presume that you'll take children away from parents because of a belief system that is unfalsifiable is a really, really inappropriate thing to do. And it really should be called out every time. It's really damaging.
yeah, totally. I agree with that. So another question, which is more positive, which is, and it's about both parents and social workers. And one is, what's the single most helpful thing that either of you think a parent can do if their child expresses a belief that they want to change sex? So that's a question for parents and what they can do. And there's the same thing for social workers. What is the single most helpful thing, if there is a single thing, that a social worker could do faced with a child either in care perhaps or in a family who is saying, I'm not a boy, I'm a girl, or I'm not a girl, I'm a boy? So for parents, first of all, what do you think from the parents' point of view?
You go first, Sinead, will I?
Okay, thank you. It's like the only uneducated, unacademic in the room.
And yet the wisest.
When it comes to like really young kids, they generally don't talk about a lot of really complicated issues. It tends to be the boy likes pink and dresses and dolls, and the girl likes blue and trucks and things like that. I think the best thing that you could do for a young child who feels that there should be the opposite sex is just to assure them that boys can like pink and dresses and girls can like trucks and climbing trees. There's nothing wrong with it. There's nothing to be ashamed about gender non-conformity at all. In the more serious cases,
And I don't know how common these are. I've tried to find statistics on this and really struggled. And the real severe cases where the children are harming themselves, obviously that would require a little bit more care. But with a massive increase that we're seeing these days, the 4,000% increase, nearly everything that I've seen wasn't talking about serious risk. It was talking about gender stereotypes. It was talking about toys and dress sense and hobbies and things like that. And I think the best thing that parents can be doing is, if your little girl says she thinks she's a boy, just say, no, you're a little girl, but you can do anything the boys can. I think that would be the best way to handle children in that way.
Thanks. Yeah. Stella, have you got anything to add to that?
Yeah, I think, you know, very often when you're distressed, you might, you know, fixate upon one solution. And, you know, time and time again, clients have come into me and they think one solution. And in my experience, no, there's very, very seldom one solution to your mental pain. Generally, it's 10 or 12 different things that will make a difference. And you will feel, you know, more able to navigate life. I do think expanding the child's world is probably the best rule of thumb. And that might mean bringing them out, it might mean rocking them up to therapy, it might mean bringing them out, making sure that they have more pleasure, making sure that they're feeling more at ease in lots of different contexts. I don't think it will necessarily mean that you should talk about gender all day, every day. If a child came to you and said they hated a part of their body and it was called them deep distress, not many people would say, let's talk about that ad nauseum. Most people would say, well, let's move beyond that and see what else is in your life. And there's real wisdom in that. And I do think that can be very helpful. Not to be dismissive. I wouldn't try to close the conversation up. I try to add and expand the child's world.
Mm. And what about for the social worker in that situation? Because we have had members tell us about, or social workers tell us about situations where they're told, oh, here's a family where the child is wanting to be affirmed in the opposite sex. The school's done it, and the parents are just being absolutely, you know, resistant, and they're refusing to accept it. In fact, they've even made complaints to the school. So here's the social workers then asked to go and do something about this. What would be the best angle?
Well, the most important thing I want to say here is that social transition is a very powerful, you know, psychosocial intervention. It shouldn't be taken, you know, it shouldn't be undertaken without clinical guidance. And to do that without knowing the person very well and without kind of having a very good and informed knowledge of gender identity issues and how they unfold is frankly quite high-handed and something that people should be very wary of. So schools presuming that they should socially transition, and then frankly, a year later, realizing that they shouldn't have and actually mistakes were made, is not something you as a social worker should be part of. You've got your own experience, you've got your own kind of, what I would hope is your competency as a social worker. And you know, you're to use that and to use your authority. And just because the river is flowing one way at the moment, a lot of people are backtracking, a lot of people are reversing now. And make sure that you become aware of the Department of Education guidelines, for example, in the UK, which is basically highlighting the fact that social transition isn't necessarily the way to go. I know there's been some laws brought in Scotland recently, and that makes it very difficult. But I do think we mental health professionals need to stand our ground and realize that taking big decisions for children is really not the appropriate thing to do at all times.
Yeah, I think that's the fact is, in Scotland, in fact, the guidance for schools is that the schools can and should affirm a child without question, and if the child doesn't want the parent to know, they shouldn't inform the child. So we've got teachers who are told, a memo comes around the school saying Vanessa is now Vaughan or Peter, and you must call them this in school. But when you invite the parents to a parent evening, do remember the parents are not to be informed, and therefore call Vanessa and those things. I mean, that's literally what's happening in some schools in Scotland, because the government has endorsed, once again, it's actually accepted the guidance. But they're saying it's up to the schools whether they do it or not, which is actually them being quite cowardly, because basically a lot of these, there's going to be comeback I think, on social workers and schools and others who do this, because as Stella said, it's not something you should just do without any professional basis or evidence.
Supervision.
Yeah, I mean, that is the really disturbing part, is that when it comes to social transition, we know that in most cases that will lead to further medical intervention. Like, was it the Netherlands who pioneered the use of puberty blockers in gender dysphoric children have observed that if you allow a child to socially transition, they're far more likely to go through with further later transitions than a child that you don't do that. And I can't remember the name of the paper anymore, but it was the University of Toronto, and they'd done a study where they found that with social transition, most of the people went through with later transition, whereas if it's you do watchful waiting, they don't, they desist. So social transition, if we are seeing that that will potentially encourage further intervention, it's nothing that should be done behind the parents' backs, ever. Like those Florida parents that are suing the school recently.
The
It's
Little
ridiculous.
Johns.
Yeah.
Yeah, yeah. And could I just say, like, we do have some information on statsforgender.org. That's a kind of a sister website of Genspect, where it discusses that paper. It's Ken Zucker and colleagues, Davita Singh, I think, from the University of Toronto, where they discuss social transition and the impact of it. But we really don't have very much evidence about it other than that paper. There isn't very much. But what we do know is we've never done it before. It's unprecedented. Never before have we been changing pronouns on children. So this is new territory. And I do think this is where we professionals need to stand our ground and say, I would rather we approach this cautiously, as we need to make sure that the child has kind of mature, responsible adults taking decisions, as opposed to be kind of propelled along by the hurry of the child. That's not our job as adults.
Okay, yeah, thanks. Now, just one last question on the practice side, and then be moving on to what the impact of this has been. But one question came in about Munchausen by proxy, which I think is now called fabricated and induced illness or factitious illness. So that's where parents are invent or an illness in their child. What, you know, has there been research on that, and what do we think the prevalence of parents actually being invested in the children have a different a gender identity different to their sex? What do we know about that?
I haven't seen studies on that subject. It's a really controversial kind of point, but certainly I think a lot of parents are being led by doctors. Some parents have a naturally independent kind of streak in them and they do their own thing. And some parents, and I've met them, they just bow to the doctor's authority. And if the doctors tell them to do A, they do A. And if they tell them to do B, they do B. And I've had parents come to me because diagnoses are not, it's not like getting diagnosed with diabetes where you can test it. This is kind of about kind of self-filled in questionnaires. And so doctors our parents have come to me saying, oh, my child got diagnosed with autism, but now actually that's been revisited and now they've got anxiety. And I'm looking at them thinking, well, that's a massive sentence. And that kind of deserves an awful lot of attention. Now, if you put that into gender dysphoria and say, oh, they had gender dysphoria, actually, we're revisiting that and it's body dysmorphia, because that's how diagnoses often happen. That you'd kind of, I know what the questioner is getting at with the Munchausen, basically saying the parent is basically bringing the child to the doctors for kind of attention for themselves. And I have heard, in fairness, I have heard one or two psychologists that I know talk about that. However, it's not something I think is the main issue. The main issue to me is parents following doctors' orders and presuming the doctor know better. And the doctors are frankly not as informed or as intensely invested as the parents presume they are.
We do hear though about parents of very young children. I think there was a couple of parents brought their 3-year-old child onto a Good Morning program, one of these chat show things, saying our little what was it, a little boy who's a little girl. So I suppose that's what the question I was getting at, is are there parents who actually trans their children very early and young?
I think there'll always be outliers. There'll always be kind of unusual circumstances with families, you know, who wish to kind of make themselves special. But I suppose my focus is on the masses who are being, I think, hoodwinked. But yeah, yes, it does seem to be an issue a little bit.
Okay. All right. So maybe moving on a little bit, and that is about the impact on the social care sector. And we were contacted by one of our delegates today, our audience today, applied to be a foster carer. And she said she would appreciate if you discussed the capture of the social care sector after her experiences, where because she expressed gender critical views and expressed that she would be unhappy about a teenage child in her care being pushed onto transitioning puberty blockers. So she just wanted to, and it turned out that the fostering agency is a Stonewall champion, that particular agency. But she then moved from that agency to go to her local council, thinking, well, they must be sane, or they must be much more mainstream or something, and got exactly the same response, which is that you're not acceptable as a foster carer or an adopter. So, and I think this is an experience that, obviously, as social workers, we are incredibly concerned about. So, please discuss the impact on the sector, and there may be questions about that coming in from people who have had similar experiences.
I'll let Stella take that one first.
It makes me very sad that an awful lot of institutions are rolling along in a way that seems mindless, because I have advocated, and Genspect does a lot of parent advocacy, and we do have a lot of guidance and outreach in this exact field. So I do urge people who are working in the field to contact Genspect, and you will get support from us. However, what makes me feel sad is that when I've gone into these meetings with schools and with other institutions like the foster care kind of agencies, the big issue is they don't know what they're talking about. And I ask them questions and they're mixing up, they're all over the place. They're saying gender and then they say sexuality. They randomly throw in intersex for no good reason, as far as I can see. It's quite obvious that these are not informed people. These are enthusiastic people who feel very positive about being kind and liberal. And they're very into that perception of themselves. And they haven't taken the time to think, hang on, I need to educate myself on this issue. Maybe there's more going on. They're in a rush, frankly, to kind of show their fabulous kind of liberal kind of ability. And they don't seem to have the humility to kind of wait and say, if parents are coming in and if a foster, parent has an issue, maybe we should read about this a little bit more. The lack of education in the general kind of masses is astonishing. Every single time I have one of these meetings, I always think, oh my God, they know so much less than I thought they would know. And that's not good enough if you work in the field.
Yes. I think that's been very much our experience as well. And asking for evidence is treated as if it's transphobic and unkind in itself, just to challenge it, which is, of course, one of our major reasons for existence, is to ask for this evidence. So somebody's actually asked, sent in a question saying, are there any central guidelines for social workers, or are parents at the mercy of individual social workers? I don't know if actually that's maybe not a fair question for Stella or Sinead, because you wouldn't know, but I mean, to my understanding, there are guidelines which tell social workers to act on evidence and to be informed by a whole set of ethical principles for their practice. And to me, this breaches all of them to be removing responsibility from parents, to be placing too much responsibility on children, to be acting without evidence. So I would say the central guidance supports us, but unfortunately, the major institutions have been captured and are actually acting against our own professional ethics, I would say. So there was
I do think if anybody's uneasy and wants to talk about it, one, they should contact Genspect and see if we can help to advocate for them. But two, to ask the people involved, what do they know? Because they will feel a lot more sure of themselves when they realize that the person who's making these kind of diktats doesn't know very much. Because that would probably encourage them to go, okay, I presumed they knew something and they don't.
Yes, so ask what their evidence
Ask questions. Yeah, ask questions.
Yeah. There's a parent or social work. I mean, I would say that for social workers as well. If given a case like that and expected to pursue a vendetta against the parents or to affirm the child, just say, let's look at the evidence, let's get the research. And of course, your new little sub website, the
Stats for Gender.
Stats for Gender, is going to be excellent for everybody involved in this field. So there's another question. This is somebody who says, I work with a lot of parents. This is a community worker, actually, mostly pre-teens and teens identifying as trans. And I have colleagues who work with younger kids. If anyone has thoughts, approaches we might take, if we fear our licenses might be threatened for doing exploratory therapy, I would be grateful. So, yeah, this is getting onto the area of where social workers and others feel very threatened that they might lose their jobs or be disciplined or whatever. So what they're saying is what approaches might help. I think you've actually said that. Yeah.
One thing I would say that I think people are sometimes surprised when I say it. I think it's stronger to come out. I think it's stronger to state your position and to come out than to stay secret because you're frightened of being exposed. I think if you know your stuff and you just keep on saying, this is my position, and you have your position, you've written it out and you keep to your position, and you look for strength in the kind of online world, you will get it. So many people have said to me, it was warmer when I came out. It was easier when I came out. I thought it was awful when I was not telling anybody and I was secret, but actually it was much easier once I came out and I said it. It's not easy, but I think it's easier than staying inside and not saying it, and you're feeling like this and you're frightened of being exposed and stuff. And honestly, if you do your work well and if you know your stuff and if you're ethical and you've got integrity, you know, there's a lot of people on our side who are very happy to help.
Yeah. I mean, I think that's true, coming out and asking and being out there, because what we've found is that those who apologize for any distress caused and et cetera, and don't come out and fight their corner are the people who actually are by the register, the Social Work England. That's when you get in, when you are not able to defend your practice, then that's when you get into trouble. Let's move on to the real threat to therapy or to gender critical approaches. And that is, somebody's from Canada actually had asked, because they're in Canada and Canada's progressed even further than Scotland in the madness. And they've got a conversion therapy bill, which isn't law yet actually. And as it's written now, she said, would deny options for young people with internalized homophobia, body dysmorphia, and other mental health concerns that often accompany and generate gender dysphoria. So this law will make any therapist who explores whether someone might be gay and for whom it's therefore not appropriate to transition, it will make them criminally liable. How are people in other jurisdictions fighting this, and have there been any successes? Because it's now being proposed in the UK. So, Stella, I mean, obviously, is that something that's happening in Ireland, or?
What do you mean?
The threat to therapists who do, conversion therapy.
Yeah. I think, that conversion therapy ban has been very badly worded. It's all over the world. They've copied and pasted. So the one in New Zealand is the same as the one in Ireland. And what they've basically done is, up until 2015, it was for sexual orientation. And it was never therapy. It was never therapy. It was an old, retrograde, horrible practice back in the 1950s and 1960s, where people tried to change people's sexual orientation. And they've brought it back in and as a concept, as if ethical therapists are trying to convert people out of sexual orientation. That's not what an ethical therapist does. But what they've done is they've added the word gender identity and, frankly, weirdly enough, gender expression. They've stuck that on to this conversion therapy ban for no good reason, as far as I can see, and except to expose that they don't know what they're talking about. And they have created this conversion therapy ban, and it's a bill for it. And I've great hopes that the tide is turning. I've great hopes that even if the bill comes in some countries, an awful lot of questions have been asked. A lot of discussions like this is happening. People are very much more ready to stand their ground now than they were before. And yeah, I know therapists are very worried, and they are very worried in my own country and in other countries. But that doesn't mean that we need to stop arguing this point, because what we're trying to provide is ethical, good, effective therapy. And it's very important to protect the integrity of therapy.
Yeah. I mean, Sinead, do you want to sort of say about how, I don't know, what your experience of the gender identity clinic seems a bit like conversion therapy to me, and that they said, oh, so do you want to talk about that from your point of view?
Yeah, I mean, there's the strangest thing that I've ever said, and that I wish that I went through conversion therapy, because it would have avoided a lot of pain for me. I just, more than anything, I can't really believe that we are lumping together sexual orientation and gender identity when we know that if we were to leave a lot of these gender non-conforming dysphoric children alone, they'd just grow up to be gay. So
Yeah.
there is a conversion therapy going on here, but it's the exact opposite of what they're claiming has actually happened. So if I'm being told that had I went to the clinic, because I was, when I went to the clinic, I identified as a lesbian. And if they were like, why don't you just accept that you're a man, that you were born in the wrong body and all the rest of it, and they're doing a good thing there. But if they were to say, okay, this has come out very suddenly, you have a lot of other issues, we'll talk about that a little bit, that would have been conversion therapy rather than making me feel comfortable as a same-sex attracted woman. So it's, I don't know, like Stella's being so eloquent and just like really nice about this whole thing, but I find it really ridiculous. I think the conversion therapy ban proposal is ridiculous. And I think that the worst part about it is that when you've got, for example, gay conversion therapy, we all think of it being like Christians and Muslims and stuff like that, religious people. Whereas when it comes to gender identity conversion therapy, it's just concerned people who want proper clinically neutral care. It's so vastly different that I can't believe they've been crammed together into this proposed bill. It's ridiculous.
And to give you a measure, I agree with you, Sinead, to give you a measure of how uneducated a lot of people, policymakers who are bringing in these bills. I had a debate with a politician who's a signatory on the conversion therapy ban in Ireland, the bill. And he kept on bringing in intersex people. And I said, what the hell do you think, what? A therapist is going to come and you're going to go into the room with the candles and the kind of incense, and they're going to come in and they've got intersex. And what am I going to do? Convert them out of it? Like, it showed an absolute, an embarrassing lack of education about what conversion therapy is, what it could be. And they don't know what they're talking about. And they're just rolling along with it. And it's not right that they don't give more attention. I think it looks like they might start to give more attention to it because we've been shouting so loudly that it's not an appropriate document.
So are the therapists, professional associations and others, and the Detrans Voices, what's their approach to this now? What are you doing and what are you saying in terms of trying to get to the policymakers on this and mount a defence of good practice?
Well, certainly we've made submissions on behalf of Genspect, and we're making more submissions to different governments around the world. And I know Thoughtful Therapists have made submissions to the UK government. And there are a lot, there's SEGM, of course, and there are a lot of organisations that are really articulately kind of voicing the concerns. Like Sinead says about, what about all those gender non-conforming, pre-lesbian 12-year-olds who are feeling uncomfortable with their body. They're not quite sure where they're at. they're feeling kind of like they're different. Where are they? If they come out as maybe they're trans because they're attracted to girls, and then they realize later they're a lesbian, who's had conversion therapy then? So it's a complex field. It's really, it needs gentle, slow, cautious, exploratory and compassionate therapy. It doesn't mean fast-tracked. And medicalizing an unfalsifiable, unidentifiable belief within somebody is a really drastic decision to make.
So that is the conversion that's going on, converting children who might become lesbian or gay or whatever. And
likely, they say around about 70% of gender non-conforming children end up being gay or bi or lesbian.
Yeah, you guys heard from that Tavistock whistleblower who was a gay man himself, who joked in a very sad way that they were running a gay conversion therapy camp at Tavistock, and that in the future there will be no gay kids left because they're all being transed. You could say that that's an exaggeration, but something similar to it is certainly happening. And if you read the testimonies of detransitioners on sites like Detrans Voices or Post-Trans, a lot of them are gay.
Yeah.
And where, so did somebody, or they were gay at the time? Sorry, I thought somebody was asking a question there that's not even in the room.
I said to Sinead, you're right, in a very deep voice.
That's what it was. Okay, so give me a fright. So as a question has come in, has either of you, Sinead or Stella or Genspect or Detrans Voices, submitted anything to the cast review that's going on in England? I mean, I think hopefully the cast review will influence Scotland, but it's an English thing.
The cast review is amazing. Yeah, we've certainly, the GDSN spoke to the cast review. That's the Gender Dysphoria Support Network, and Genspect spoke to the cast review. And also on behalf of the IATTD, which is the therapist for detransitioners, we also spoke to the cast review. The cast review is clearly trying to get a very comprehensive view of what's going on. And as far as I could see, at least they knew their stuff. At least you were talking to somebody who knew what you were talking about and weren't garbling and mangling concepts and words the way other people I've spoken to, like schools and politicians.
Yes, well, Ebbs was contacted and spoken to the cast review, and hope, are quite optimistic that will come out with some really good guidance and outcomes at the end. So we've got about 10 minutes left of the seminar, and I've kind of run through most of the questions that have come in, and I'm checking the question and answers. I think we've answered probably both of those. There's a question about attachment theory and children who are adopted or in foster care having issues surrounding the need to belong and to be loved and wanted. How can people working in the field not see that adopting a trans identity, that this can be a desperate move towards gaining acceptance and love? So that's specifically, I think social workers will be children in care are apparently, I've read, more susceptible to these claims about gender identity. And I suppose there was 2 court cases in England where the one in which the local authority went to court to try and stop adopters transitioning the children because they'd actually adopted 2 completely separate children and then declared that they were trans. And there was a court case, I think it was Lambeth Council, went to court to try and stop it and lost. And another case where I think I don't know, that another case was where I think the local authority was trying to enforce a transition. So, but either way, it's obviously this field of adoption and fostering and children care who are very vulnerable to abuse and all sorts of adversities and harms. Gender identity seems to be, just causing a lot of problems there. I don't know if you've had the experience.
Yeah, the attachment theory is a very interesting point, and there does seem to be something very much connected with our sense of self and our sense of identity, and a lack of attachment maybe in infancy. So that it's noticeable that gender issues are very high among adopted people, and also high among kind of in care homes and residential homes, which is why we need people to be more informed, because they are very much impacting the kind of the status quo.
Gosh, where were we? All right. So I just had a really good question there, and I've now forgotten it. Yeah, just in relation to children in adoption who are very vulnerable to
well, children who are adopted, they're vulnerable in lots of different ways. But one of the ways that is new is, I think this is where you're going, Maggie, but jump in if I'm going wrong. One of the ways is your sense of roots of who you are in a very kind of deep sense of your kind of your being. And if that feels shaky or fragile, you could easily kind of identify with another personality, or to be, you know, a different person. You could identify. It's very easily understandable why somebody in certain contexts could be more liable towards seeking transition than other people. Some people have a very strong sense of self, and some people have had a different type of experience, and it's led to a weak sense of self. And when you have a weak sense of self, you're more easily kind of brought into different kind of ways of being, and more easily you lose yourself. And it's a horrible feeling when you lose yourself, because you're desperate. Like, there's a great book, Hold On to Your Kids, by Gabor Mate and Gordon Neufeld. Yeah. And it's a brilliant book. And it's all about, you know, how when a teenager doesn't have a strong sense of self, how lost they feel, how frightened they feel. And they'll latch onto things. They'll latch onto their best friend. They'll latch onto their boyfriend. They'll latch onto gender identity. They will latch onto things because they're desperate to get a strong foothold in life. And they feel kind of a little bit out of control, and they feel completely shaky. And so when they're offered something very substantial, which is a medical path, a solution, a new identity, it's like, oh, thank God, yeah. You take it away. Yes, sign me up to all of that. And it's very understandable when you start thinking about it in a psychological way.
Yeah. So I suppose the question actually that had popped into my mind was to ask, which was the other side of that, really, that or possibly not, but social contagion and the business of whole groups of girls identifying, because I read somewhere that it was said that if that, you know, groups of girls in this group friendship groups would all declare themselves trans at the same time. So I suppose it would just be interesting to hear some thoughts about that, and about whether, from Sinead's point of view, you had friends who were in a group and classrooms. I know you were a bit older, but and whether Stella's come across that.
I mean, for me, like, I did skip that, but I didn't know any other trans people during my own experience. But I will say that the vast majority of the detransitioners who have contacted me over the past 2 years have been younger than me, and have had that experience where they came out first and then their friends followed, or a couple of their friends came out and then they came out. And when I first started hearing those stories, I was like, this is obviously the rare version. This is obviously the bit that doesn't happen that often. And then more messages and more messages. And I was like, okay, this is apparently a thing. And that's when I found out what social contagion was, because I'd never heard about it before. And then that's when I found out, you know, it's very similar with anorexia and bulimia. In past decades, it's been very similar with like witchcraft and DID, dissociation and stuff like that. I didn't know that was a thing at all. And the more that I have been speaking specifically to younger detransitioned women, where they're like, yeah, the pattern was very simple. It was internet and social group, or social group and then internet. And one led to the other. And then before you knew it, your whole cohort were trans, non-binary, gender fluid. So they didn't all necessarily medically transition, but the adoption of a non-cis normative identity is massively prevalent among young, you know, teenagers, or where the teenagers who are now in their early 20s. And they're telling me about it, and it sounds insane, but they can all be lying. There's so many of them, it's a bit wild.
Well, on that point, though, I mean, I've been a bit horrified to see that in lots of schools, they have these LGBT QI+++ groups run by teachers and with adult, 17 and 18-year-old teenage boys and girls. And they're inviting 11-year-olds who start in what we call first year, but I think it's year 8 or 9 in England or Ireland, I don't know. So, you know, the role of these groups seems to me quite...
Could I say something about that? Yeah, it's a bit of a pointless role, that those groups, because Malcolm Clark, the gay man who is in the LGBT Alliance, he's written about that very eloquently. And he pointed out, you know, groups really, especially groups of children, they need a purpose, like, you know, sports or chess or writing or photography. And for the purpose to be, we're 12 and let's discuss our sexuality, like, you know what I mean? It's not madly appropriate. It's not really what the kid needs. What the kid needs is an accepting atmosphere, and the kid needs to feel a freedom to be themselves. They don't really need to have a group that focuses in on their sexuality or their gender identity, because to what end? The brain is a problem-solving organ. They'll look for problems. You've got to have a focus in a group. It's like, let's all sit around to be philosophers. You know what I mean? You've kind of got to narrow the focus, or where will it go? It doesn't really make sense as a group unless they're going to do a campaign. We're LGBTQ, whatever, and we're going to, and they might do something, an artistic thing, or they might do a writing magazine, something like that, I get, but just to be, it doesn't actually make sense.
It's also, but the age thing, you know, to have an 11-year-old with 18-year-olds immediately is a red flag for me, thinking you wouldn't want any 11, 12-year-olds being because obviously older children are more sexual and they are allowed to be sexually active over 16. So there's a huge conflict of interest there. So we're getting really near the end, actually. So I'll give you, it would be very nice if you could want to say a word or so before we finish about anything you think hasn't been said or raised, or that might be helpful for all of these anxious social workers listening and hoping for a pathway forward.
I'd like to hear really what Sinead has to say, but all I've got to say is to social workers, get to know others, contact us, find others, get some strength and unity. It's too scary on your own. Find some colleagues.
Yeah, great. Sinead?
Yeah, very, very similar to Stella. I would say, you know, if you're one of the therapists or social workers or teachers or whoever who is sort of feeling a little bit scared to speak up because, you know, you don't want to lose your job, you don't want to be castigated or anything like that. I mean, your reputation is not more important than the livelihood and the well-being of children. And this is where this is leading. You know, if we don't start talking about this more and doing something about this, we're going to have more people like me, or we're going to have people worse off than me. We're going to have people who transitioned while they were very young, who had the hysterectomy and all the rest of it, and have now in their minds, and I'm saying this, these aren't my words, this is what I'm hearing from the younger detransitioners, that they've ruined their lives because their clinicians and their teachers didn't have the courage to say, you know what, maybe something else is going on. So if you are on the fence, if you're a little bit nervous, if you don't really want to dip your toe in, think about the harm that you could help prevent if you add to the voices and saying enough is enough.
Yeah, absolutely. There's a lot of messages coming in saying, well said, and that, you know, this is a real issue and we must, you know, stick our courage to the mast, really, and courage calls to courage everywhere. So I'd just ending the webinar, then I'd like to end by, like, loads of people are putting lots of messages up saying thanks very much, love what you're saying, and just on what Stella was saying is contacting other people. That's why the Evidence-Based Social Work Alliance exists. So please do contact us. We've got a website, Genspect exists as well, and Stella's made that's a good offer for anybody with worries, and it will give you professional confidence and strength to be in touch with other people. So do be in touch if you're out there and listening and worried. Be in touch with EBSWA and get professional strength and organize in little groups. I think in your area, find people that you know are sympathetic and organize in order to approach your employers and challenge what's happening, express concerns. make it quite clear to them that you will hold them responsible for a guidance that's got without evidence for you to breach professional ethics and standards. So that would be our advice. So just in finishing, I would really like, thanks very, very much to Sinead and to Stella. I can see that we might be inviting you back again, because I think we did a lot of surface things, and there's maybe things that could be explored more in depth. But anyway, thank you very much. I've learned loads from it, and I'd like to thank you both and wish you well with both of your endeavours, and I'm sure we'll be working together as we go on. So thanks everyone as well for joining the webinars you have, and for all the comments and questions that were submitted. So thank you very much, and we'll see you at the next one.
Thank you.
Bye. Bye.
Bye.